Good morning, everybody, and thank you for joining us. We are so honored to welcome CMS Administrator Chiquita Brooks-LaShore to Colorado. CMS is really an incredibly important agency for us, relevant to our implementation of healthcare reform in Colorado, and we are excited to have a great partner in the Biden-Harris administration and in Administrator Chiquita Brooks-LaShore. We have the exciting opportunity today to celebrate the approval of Colorado's benchmark insurance plans. This is for everybody who buys their insurance on the individual and small group market. So that's who we're talking about today. Large employers, large groups, self-insured, separate category, largely not under CMS. But today, individual and small group, a big chunk of Coloradans get their health care this way. And today, we're announcing the approval of some additional benefits for all the Coloradans in the individual and small group market. I want to recognize we're joined by Lieutenant Governor Diane Primavera. She is the head of our Office of Saving People Money on Healthcare. With her leadership, we've passed landmark legislation, including the Colorado Option Prescription Drug Affordability Board. We just had an excellent meeting with the administrator and our team to discuss the implementation of these proposals in Colorado. We're also joined by Senator Brittany Pedersen, who is a true champion of expanding behavioral health and substance abuse services to every Colorado who needs them. And of course, I want to thank CMS Administrator Chiquita Brooks-LaShore and Deputy Administrator Dr. Ellen Montz for their continued support and, of course, for their physical presence here in Colorado. We have a lot of work to do together. Some great areas that we can share some accomplishments today, but a lot of work ahead to save people money on healthcare and expand coverage. So a little context for what we're talking about today. Back in 2019, the federal government approved Colorado's reinsurance program. That meant that Coloradans who were paying some of the highest insurance premiums saw them drop by close to 30%. On average, Coloradans saw their insurance premiums in the individual market drop by 20%. Thanks to that program, people see significant savings. The final 2022 premiums will be released later this week. They will be fairly close to the projected ones that we announced a month or two ago. Today marks another important chapter. Beyond the historic nature of the benchmark plan, which includes first in the nation gender-affirming care benefits, helps us realize our Colorado for All vision. These plans that are approved include critical support for Coloradans struggling with substance abuse and behavioral health. And these last 18 months have been difficult for everybody, but we've also seen the impact on people's mental health. And in some cases, the pandemic has intensified behavioral health and substance abuse issues that Coloradans are facing. Back in 2019, I was proud to form the Behavioral Health Task Force to get to the heart of Colorado's behavioral health issues and streamline services to be consumer-facing. When somebody's facing behavioral health systems, it's very difficult to deal with a large bureaucracies. We want to make it patient-centric, and those efforts are underway. We've also partnered with legislators like Senator Pedersen to increase the number of Coloradans who can access behavioral health by investing in workforce capacity needs. As you know, there's an interim process about using American Rescue Act funds to the tune of about $400 million to transform behavioral health. And now, with the 2023 benchmark plan, we're expanding access to services on the individual and small group market. Colorado is one of the first states in the nation to include an annual mental health wellness exam in the benchmark plan. This visit can include behavioral health screenings, education, consultation about healthy lifestyle changes, physical or mental health, referrals for ongoing mental health treatment needs, and the discussion of potential medication options. This plan also addresses substance abuse disorders by expanding the number of opioid alternatives that insurance companies will cover to 15, including the option of acupuncture for pain management. This may sound like simple, routine services, but the reality is that these services were out of reach before and now are achievable for Coloradans in the individual and small group market and can save lives and prevent substance abuse. With every dollar invested in supporting our behavioral health system, we're supporting people, real people, and creating a Colorado where everybody has the opportunity to thrive, no matter who they are or what challenges they face in life. Colorado's strong when our people are strong, and today's benchmark plan is moving us forward in the right direction. I'm honored to introduce CMS Administrator Chiquita Brooks LaShore.
I want to start by thanking Governor Polis, Lieutenant Governor Primavera, and Insurance Commissioner Conway for having us today and for their leadership. My name is Chiquita Brooks LaShore. I am the administrator of the Centers for Medicare and Medicaid Services. Through our programs, Medicare, Medicaid, and CHIP, and the Affordable Care Act's health insurance marketplaces, we provide more than 144 million people with life-saving coverage. Healthcare should be accessible, affordable, and delivered equitably to all, regardless of your sexual orientation or gender identity. The Biden-Harris administration, through the Centers of Medicare and Medicaid Services, is committed to removing barriers to coverage and care for LGBTQ+ people and applauds Colorado on this important step. Today's expansion of Colorado's essential health benefits to include gender-affirming surgery and other treatments is an important step towards ensuring equity and access to care for Coloradans. Coloradans buying health plans in the individual or small group market beginning in 2023 can be assured it will include coverage for gender-affirming surgery and other treatments that affirms their gender, including for medical or behavioral health needs. For too long, transgender people have faced barriers that have made it difficult for them to access doctors, affordable coverage, and medical treatments. Today marks the first time that a state has sought to add additional gender-affirming care as an essential health benefit. We hope this marks a historic beginning and that other states look to Colorado as a model and take advantage of the opportunity to ensure that their benchmark plan meets the needs of all people in their communities. Gender-affirming care can be life-saving. By making this care essential, the benchmark plan will guide what is included in health coverage statewide. This expansion of coverage is a model for other states to follow, and we invite other states to follow suit. The Biden-Harris administration is committed to removing barriers to coverage and care for LGBTQ+ people, and we are proud to stand alongside Colorado as they take this momentous step towards health equality. Earlier this year, President Biden issued an executive order that calls the federal government to pursue a comprehensive strategy and approach to advancing equity for all. The term equity means consistent and systematic, fair, just, and impartial treatment of all individuals, including individuals who belong to underserved communities that have been denied such treatment. Importantly, HHS recently announced that we will enforce Section 1557 of the Affordable Care Act and Title IX's prohibitions on discrimination on the basis of sex to include discrimination on the basis of sexual orientation and gender identity. This means that it is the position of the Department of Health and Human Services that everyone, including all LGBTQ+ individuals, should be able to access health care free from discrimination or interference, period. We look forward to working with Colorado on implementation and stand ready to assist other states wanting to follow its lead. I'm now going to turn the podium over to Lieutenant Governor Primavera.
Well, thank you and good morning, everyone. I'd like to begin by joining Governor Polis in thanking Administrator Brooks LaShore and Deputy Administrator Dr. Montz for traveling from Washington, D.C. to help us celebrate this exciting milestone for healthcare in Colorado. I'd also like to thank Commissioner Conway, the team at the Division of Insurance, and all those who have dedicated their time and effort to making Colorado's benchmark healthcare plan more equitable and inclusive, ensuring that everyone in our state has access to high-quality, affordable, equitable health care has always been a top priority for our administration. Piece by piece, step by step, and with guidance and support from patients, advocates, providers, state leaders, legislators, and federal partners, we've made significant progress toward that goal. So today's announcement from the Centers for Medicare and Medicaid Services, or CMS, is another important advancement. Gaps in access to behavioral health care and substance use disorder care, as well as health care for LGBTQ plus Coloradoans, persist. As we envision the next phase of our healthcare reform efforts, closing those gaps is of the utmost importance. For 5 months at the beginning of this year, the Division of Insurance held stakeholder meetings to determine what kinds of benefits should be added to Colorado's benchmark healthcare plan. As a direct result of those conversations, and now with approval from CMS, beginning in 2023, Coloradoans on the individual and small group market will have access to expanded benefits, including, as we've heard, gender-affirming care, acupuncture, a yearly mental health wellness exam, and expanded options for alternatives to opioids. Continuing in our long-standing tradition of leading the nation, Colorado will now become the first state in the country to include gender-affirming care services in its benchmark plan. I know from personal experience how important it is to feel safe, comfortable, and heard by the providers who help us manage the most intimate and sometimes the most painful healthcare needs that we have. As a state, we want to support patients and providers as we create a more inclusive and affirming healthcare system. Increasing access to gender-affirming care is also an important tool in our arsenal to improve mental and behavioral health outcomes for Coloradoans, specifically our LGBTQ plus neighbors. Transgender and non-binary youth experience anxiety and depression at much higher rates than their cisgender peers, with many reporting that they've seriously considered suicide in the last year. When coupled with the other approaches like social and family support, gender-affirming care can drastically improve mental health. In Colorado, we believe that all roads lead to health, and that a holistic approach to health care reform will set us on the path towards a future where all Coloradoans can get the care that they need to thrive and be their healthiest selves. Colorado's future is bright, and I hope that today's announcement will be a beacon of hope for anyone who has felt that the support they needed at their most vulnerable moments wasn't there. I'm now honored to introduce our Commissioner of Insurance, Michael Conway. Thank you.
Good morning, everyone. I want to thank Administrator Brooks LaSure, Deputy Administrator Dr. Montz, and the entire CMS team for coming here to Colorado to announce their approval of the benchmark plan. It is a testament to all of the good things that we are doing in the state that they are willing to come visit us in person for this great announcement. I also want to thank the governor and the lieutenant governor, not only for their support, but also for the encouragement to be bold, to do things differently, and to be innovative. And I want to really express my gratitude to my team at the Division of Insurance that worked so hard to get this done, specifically Kate Harris, Kara Cheevers, Tara Smith, Leilani Russell, and Deb Judy. They worked hard to assemble the work group that reviewed the current benchmark plan and essential health benefits, have stakeholder meetings, review all of the input and comments, and then submit it all to CMS. It's been a big lift for the team. Frankly, this wouldn't have happened without them. I'm incredibly proud of them and all of the work that they did. During the course of the Polis Primavera administration, we have made significant progress regarding health insurance in Colorado. We've stabilized and made the individual market more affordable with the reinsurance program, leading to more competition throughout the state and saving people money on health care. And we've worked hard to improve the benefits and the coverage people are purchasing. And the benefits included in this benchmark plan for 2023 and beyond are more inclusive and meaningful for Coloradans, in particular LGBTQ plus Coloradans. For the first time in the nation, a benchmark plan will include gender-affirming care. And we were also able to include benefits to make mental health care more accessible and affordable for Coloradans and help fight the opioid crisis in this state. This all adds to our efforts to develop the Colorado option to not just make care better and more affordable, but to make it more equitable as well. Again, thank you to Administrator Brooks LaSure, Deputy Administrator Dr. Montz, Governor, Lieutenant Governor, and the entire team at the DOI. And with that, I will introduce Senator Penderson.
Hi, everybody. I am so excited to be here today. This is a really big step forward to actually ensure that we're bringing parity so that when, people, when they're not feeling well or they get their annual exams, that's covered with insurance if it's for physical health. Unfortunately, that has not been covered historically in Colorado around mental health. So this is really important when we talk about prevention and making sure that people are getting access to the health care that they need and the screenings up front before they go down a path of ultimately, using drugs, becoming addicted to self-medicate, something like anxiety or depression because they didn't get to catch that up front. Specifically, I want to highlight how important one piece of this is. The benchmarking that really sets the floor for access to alternatives to opioids. We know for decades we had a system that incentivized overprescribing. That was lobbied for by pharmaceutical companies at the national level. And unfortunately, with the mandates that came down, it incentivized doctors to overprescribe opioids. They were paid more if they did so, if they were rated on their pain, on their surveys. We are changing that at the national level, but there's still so much that we need to do to actually shift the culture that was created of after decades, unfortunately, of overprescribing. So when we talk to doctors about not prescribing opioids and actually addressing pain with prescribing alternative medications or treatment, they often talk about how this is usually the only thing covered by our insurance. That is absolutely unacceptable. And I am so lucky to live in a state where we have leaders like the governor here in Colorado to actually change this coverage. This is going to be meaningful for a third of Colorado's population. When they are going to the doctor, that they are going to be able to look at additional options instead of drugs that are oftentimes the cheapest up front but lead to devastation later on, that they can actually get the care that they need without having lifetime consequences because of that, which ultimately comes down to the state as being incredibly costly. So I'm really proud of what we're doing here today. We have so much more work to do, but I also want to highlight the Behavioral Health Task Force that the governor put together last year to really address the systemic issues and provide a map of where we need to go in Colorado to address the barriers that people face in the behavioral health space, which, as you know, is access to mental health care and also substance use disorder treatment. We are building upon that with leadership at the Capitol, with our American Rescue Plan dollars this year to oversee an additional $450 million to look at what we can do to change the system. We know that it was broken. I know firsthand, having lived here my entire life, going through it and watching my mom struggle and the lack of options for her. We have been fighting together to really close those gaps here for Coloradans and make sure that we have a healthier, happier place to live. And so this is also an incredibly important time because of the pandemic. Many Coloradans are struggling right now. We have seen overdose deaths skyrocketing, and we've seen mental health crises increasing with lack of options. And so we look forward to continuing this work together. I want to thank everybody in this room who has also been a part of this. Thank you to the governor and the lieutenant governor for your ongoing leadership. Thank you so much.
Thank you, Senator Pedersen. We'd be happy to take some questions.
I've got a couple. The first, and I'm not sure who can answer this, but I'm going to just throw it out there, and whoever wants it. What's the universe for gender-affirming care? What kind of services are we talking about here, and how are those services certified as appropriate, legitimate? I'm not even sure what the right word is for that. That's the question. And for you, Governor, you have stated on more than one occasion that you're opposed to insurance mandates, but this is a heck of a mandate on the insurance industry. How much is this going to cost the industry, and will this wind up being passed along to consumers through higher premiums?
So this is part of our saving people money on healthcare model, and to be clear, we want to see cost benefit. We want to see the benefits of what is covered by insurance. So obviously, never been against insurance covering things. We're for that. We just want to make sure that what it covers reduces costs. And opioid dependency is one of those key areas around behavioral health where there's an imperative to reduce costs. First and foremost, the human cost, the human toll of opioid dependency, but associated with that is an enormous financial cost of opioid dependency. Lost earnings, it's a cause of homelessness for people, losing jobs, loss of income, tearing families apart. So preventing that by offering alternatives for pain management and also alternatives for recovery from opioid dependency absolutely saves money on healthcare and saves lives. And so that's the lens that we apply to these kinds of requirements to make sure that when Coloradans can help escape the cycle of dependency or avoid opioid dependency in the first place, it saves lives and saves money. And I'll turn it over to Commissioner Conway on your other question.
I would also piggyback off of that and apply the exact same kind of thought process to the gender affirming care component of the benchmark plan. So the gender affirming care aspect to make sure that people can get the care that they need to live the life that they want to live and the life that they actually identify with has all of the same mental health benefits that the governor just went through on the opioid piece. So Marilyn, I want to make sure that I'm answering your first question completely, so repeat that for me.
Yeah, what's the universe? What kinds of services are we talking about here? I believe Ms. Brooks-LaShore mentioned gender surgery. I'm assuming it's gender reassignment surgery she's talking about, which is, I mean, that's an expensive operation, which anybody that's ever looked at this issue can tell you. And that's kind of why I'm asking about the cost issue, because that's a mandate on insurance companies, and I'm just curious about that driving up the cost of health insurance premiums. But I also want to know what kind of services are we talking about?
So the services in particular that we're talking about are things like cheek and chin and nose transplants, lift augmentation, mandibular angle augmentation or creation or reduction, laser or electrolysis hair removal. Those are some of the big services that you typically talk about and hear about, Marilyn. But I think to get to your point about the cost component, so we did that analysis as part of our benchmark review. And what we found is that the cost of all of these pieces that we're building into the benchmark is negligible. So we're talking about 64 cents per month for folks enrolled in the individual and small group market in order to have all of these great benefits that we've talked about today. And the long-term benefits of including this coverage are huge, are massive, to make sure that we are taking care of people's mental health, to make sure that we are fighting the opioid crisis, to make sure that we're actually giving people the care that they need in order to live the life that they want to live.
Hello, Wingeter from the Denver Post. Can you hear me?
Yes, please go ahead.
All right, I have a two-part question. The first part is, at this point, is everything with the approval pretty much set, or is there like a rulemaking process to go through on which specific services and that? And the second part is, obviously the individual market is a pretty small percentage of all insured people in Colorado. Is there a plan to look at expanding some of these benefits to a broader group?
So it's individual and small group, and combined they're about 30%. What percent is that? 20 to 30. Yeah, 25%. Yeah, I mean, it's individual and small group first of all, and it's around a quarter of Coloradans in those two combined. On the other question, I'll turn it over to you want the administrator.
No additional rulemaking at the federal level is necessary. The more details certainly will come out from the state, but this was approved as part of what we call a state plan amendment, and now Colorado has the authority to move forward.
Thank you.
And this is for Senator Pedersen. Most of the insurance mandates that have gone to the governor in the last 2 years have come through the legislature. This one did not. Why not?
Well, actually, that might be for, I mean,
There's overlap on how that,
I
yeah.
the opioid one, yes, that absolutely did. But this gender affirming care, I don't remember ever hearing this in the legislature in all of the conversations about different insurance options. This is not one that I ever remember being a discussion point. I think I can guess why, but I'd like to hear it from you.
Well, actually, I think that this is a great opportunity to highlight the leadership that's necessary that we have in our governor to actually utilize his position and the opportunities that we have without even legislation to move forward on the things that are important for every Coloradan. And really want to highlight, because we weren't just partnering on a bill going forward, this was leadership outside of the legislature to actually, outside of us bringing a bill and saying we must do this, that they came together, had a stakeholder process, an inclusive public process to identify the things that we need to prioritize to address the opioid epidemic and alternatives. So really proud of the work we've done together to partner in the legislature and also the leadership outside of the legislative process.
Did that stakeholder process include the insurance companies?
Absolutely, all of our stakeholder processes include the insurance companies.
And if I can just have one final comment, I'd say when we look at costs and benefits of coverage, I had to be convinced that this will save more than 64 cents per month, which was the cost, and I'm convinced of that with the data, that this will save substantially more for the insured population than the 64 cents a month that it costs, particularly in the form of reducing opioid dependency, which is tremendously costly from a human and financial perspective.
Actually, we have one last question
Okay.
on the phone. John Daly.
Hi, John Daly, Colorado Public Radio. This is a question for the CMS administrator. Do you expect other states to follow suit and join Colorado in offering these benefits?
Thanks for the question. It is my experience that states can be incredibly interested in what other states do, and I think that Colorado making this step of going forward and affirming this desire will cause other states to also take a look at their coverage and think about whether to add gender affirming coverage as well.
We're also joined, by the way, our head of our healthcare financing agency, Kim Bimsteffer, is with us. Thank you for joining us, Kim. Kim will be meeting with the administrator as well. The administrator met with our insurance commissioner and lieutenant governor and others as well. Any final questions? Okay, thank you all for joining us.